Good afternoon. Thank you for joining us today. The reality is in San Diego County, the COVID-19 cases remain higher than we would like to see. We are seeing an increase in cases, an increase in hospitalizations. And again, this is driven almost exclusively by the unvaccinated individuals in San Diego County. As a county, we joined the state of California, the city of San Diego, and other entities in mandating that our employees get vaccinated or be subject to weekly tests and mask wearing. The facts are indisputable that COVID is on the rise, in particular in those communities that are unvaccinated. And as a community, we have an obligation to do everything we can to get as many people vaccinated as possible. We know that where we are in COVID today, getting a vaccine is the single most important thing you can do, not only to protect yourself, but to protect the broader community. And so today, the County of San Diego is officially recommending that all employers across our county require their employees to either get vaccinated or be subject to regular testing and mask wearing in much the same way the County of San Diego has done, the state of California has done, the city of San Diego has done, and other entities are doing. I wanted to share with you a couple of the statistics to demonstrate the point. In the last 30 days, 92% of COVID-19 cases, 92% of new COVID-19 cases in San Diego County are in the unvaccinated. 8% are those that are fully vaccinated. That gives a case rate that is 10 times higher for unvaccinated San Diegans, which is why, again, we are making this recommendation that all employers, public sector, private sector, nonprofit, all take the action to require their employees to get vaccinated or be subject to regular testing, weekly testing, and a mask requirement. As you can see here on the chart, again, going back basically the last 30 days, you can see that 98% of hospitalizations from COVID-19, 98% are in those individuals who are unvaccinated, which again highlights the importance and really drives home the vital step that we need to do to get San Diegans vaccinated. Now, as a county, we are doing well. More than 80% have received their first dose. A significant number are fully vaccinated, much higher than other counties across California, certainly much higher than other states, which is why we have not seen the severity of the situation. But we have to be mindful that there is a strain on our healthcare system, both from these increasing cases, from increases in other illnesses that are happening, from staffing challenges that we see. And so again, we are here today to officially recommend that all employers across San Diego County require their employees to be vaccinated or be subject to regular testing and masking. We think that this gives us the best opportunity to move forward. Starting tomorrow as a county, August 17th, we will begin collecting vaccination verification from our employees here. And on Monday, August 23rd, we will require employees who have not demonstrated proof of being fully vaccinated to be subject to weekly testing and to wearing masks indoors. And we think this is another step as a region. If large numbers of employers will take this action and step, can help incentivize and can help us move in a positive direction. So again, we're adding this recommendation today. We recently brought back the recommendation for individuals to wear the mask in indoor settings. We think these are all things that we can do to slow the spread that won't in any way impede our ability to have our economy recover. These are things that won't impede our ability to get our kids back in schools. These are things that won't impede our ability to live our life and go about doing it. But the vaccine is the single most important thing individuals can do. We also want to share for employers that are out there, we do have testing sites available throughout San Diego County. We are increasing those testing sites. And so for individuals who might be party to that weekly testing, we are continuing to make testing available. And we also will continue to make vaccination sites available throughout San Diego County for those who are out there. And we urge all San Diegans again. We came together as a community. We dealt with so much over the course of the last year and a half, 2 years. We are in a much better position than we've been because of the vaccine. But again, there is concern around the increase in cases, around the increase in hospitalizations. And so we're going to do everything we can as a county to protect our public health, to protect our economic recovery, to protect our societal recovery, and to make sure that we can remain in a strong position to move forward as a region. We're going to hear now from Vice Chair Nora Vargas, and then we will take your questions. We have both Dr. Wooten and Dr. McDonald here as well to answer questions. Vice Chair.
Thank you, Chair. The recent surge in COVID cases is proof that the pandemic is still present in our communities, and we all need to continue to do our part to stay safe and healthy. And so our hospitals, as the Chair has mentioned, have risen in hospitalizations, and we certainly don't want to be in a situation where we're going back to where we were before. So we've made great progress in vaccinations, but we still need to continue to be vigilant and do the work we need to do to beat this pandemic. We all know that the best strategy continues to be to ensure that we get vaccinated and tested if you believe you're sick. Our county has expanded our testing capacity to meet that demand, and I think that's important to emphasize. Please make sure you get your vaccine if you haven't done so. This recent surge is propagated by unvaccinated individuals. So today I stand with my colleagues recommending that employers help us by voluntarily increasing safety measures. We want our businesses to stay open and our economy to continue to recover. Requiring all employees to get the vaccine or to test on a weekly basis is the right thing to do. It will protect your consumers, your customers, and your businesses. Como ustedes saben, recientemente hemos visto un incremento de casos de COVID en nuestra comunidad, lo que nos indica que sigue muy presente la pandemia en nuestras comunidades. Desafortunadamente, nuestros hospitales también han registrado un fuerte incremento de hospitalizaciones. 98% de ellos son personas que no están vacunadas. Por eso quiero enfatizar que la mejor estrategia para combatir el virus sigue siendo la vacunación, y aquí lo pueden ver con esta información que nos están presentando. Nuestro condado sí ha incrementado la capacidad de nuestros centros para poder tener pruebas de COVID, porque sabemos que es importante que las personas que tengan algún tipo, que crean que están enfermos, puedan ir. Si no se han vacunado, por favor, acuda a uno de los centros del condado, ya que el reciente incremento en este caso es principalmente entre aquellas personas que no están vacunadas. Empezando el 23 de agosto, el condado de San Diego va a requerir que las personas no solamente demuestren que están vacunadas, pero si no están vacunados, les vamos a pedir que por favor hagan su examen de COVID una vez a la semana para que podamos estar seguros que las comunidades están seguras. Seguiremos promoviendo la vacunación, ya que es accesible, segura y sin costo, pero como ustedes saben, necesitamos la colaboración de ustedes en la comunidad. El día de hoy estamos aquí para recomendar a todos los negocios que pidan a sus empleados que se vacunen de manera obligatoria o que se hagan una prueba de COVID una vez por semana. Queremos continuar con nuestra recuperación de la economía equitativa. El elevar sus protocolos de esta manera ayudará a impedir que el virus siga propagando en la comunidad. De que de esta manera podamos proteger a los empleados, clientes y sus negocios. No queremos regresar al cierre de nuestras comunidades. Y es por eso que les pedimos a todos, a los negocios de nuestra comunidad, que eleven sus protocolos de seguridad, trabajemos juntos, como lo hemos visto antes, y salgamos de esta pandemia lo más pronto posible. Thank you. Gracias.
Thank you, Vice Chair Vargas. Again, just to reiterate, as one of the largest employers in the county, more than 18,000 employees, this is a step in action that we took. I know Mayor Gloria and the city of San Diego have done the same. Governor Newsom, the state of California, along with a variety of other settings, have done it. And so we are just recommending that all employers throughout our region take this same step. Require your employees to demonstrate proof of vaccination or be subject to weekly testing and utilizing a mask. Again, more than 92% of COVID cases in the last 30 days are in the unvaccinated. 98% of hospitalizations in the last 30 days are in the unvaccinated. And so we're going to do everything we can as a region, but it is clear what is the single most effective thing to slow the cases and slow the hospitalizations is getting as many San Diegans vaccinated as possible. With that, we're happy to take your questions. And again, both Drs. Wooten and McDonald are here for your questions. Yep.
Thanks for putting this together. A couple questions. First question is basically, what makes you think this will work? The county has done a whole lot already in terms of putting in place a vaccine infrastructure. You know, we've still got a population maybe of close to 500,000 folks who are eligible but haven't even gotten the first shot. Others who haven't gotten the second. What are you seeing to make you think this will work? Have you had conversations with regional chambers of commerce with employers to suggest that they haven't required vaccination yet, but if the county were to recommend it, you guys would do so. Second question, basically, what if it doesn't work? What if cases keep climbing? Are you prepared to require indoor masking the way that LA has, for example, or require vaccination in indoor spaces the way that San Francisco has indicated?
So I'll take the second one first. We haven't been speculating about what may or may not happen with COVID throughout the duration of this, and we're certainly not going to start doing that now. We monitor every single day in real time the cases, hospitalizations, and the impact to our system. And so we'll continue to monitor that, and we'll continue to take appropriate steps as we go forward. Again, it's really clear, particularly when it comes to hospitalizations, what the danger and threat is, and that is unvaccinated. So that leads us back to your first question. I have talked to a lot of employees who said, hey, you know what, a little nudge would help us out, would get us over the hurdle. Because look, these things are difficult, right? It's hard. You're going to have to go to your employees, and you're going to say, hey, you're going to have to do this. There's a little bit of a burden that's going to be present upon businesses to try and implement this and do it. But we think that the step that we're taking today will provide the impetus, hopefully, for at least some number of our businesses throughout San Diego County to do this. And we really are talking around the margins. When you're at 84% of San Diegans that received a first dose of eligible San Diegans, I'm talking about 15, 16% left. Some obviously have to get fully vaccinated. We know in some of the survey work we've done, which we've shared, that there is a segment out there that is unvaccinated that would be willing to get it. They just need a little bit of a nudge, a little bit of encouragement. There's a segment out there that probably will never do it. But we think that this is an action or a step we can take that will increase the number of people getting vaccinated. And so we're going to continue to try and do everything we can. We're also going to continue to make it widely available. We're going to continue our outreach campaigns. We're going to continue our paid media campaigns. And we're really asking San Diegans to trust your doctor who you would go to if you were ill, your doctor that you would go to get advice on what you would do. And they are united in their approach and what we're doing. So we think this is a step. We think it certainly has the potential to help, and we'll have to monitor it as we move forward.
Understanding the reticence about speculation, but shouldn't employers be ready for a mandate if in fact it doesn't work? I mean, can we use that word just if the numbers continue to trend up?
Well, we're not going to speculate on what's coming. We're doing what we can with what we have right now. What we know right now is this is a pandemic of the unvaccinated. More than 92% of cases, 98% of hospitalizations. We think this is an important tool that can help increase the percentage of eligible San Diegans that are vaccinated. And we will continue to monitor the situation every single day as we move forward. But again, as those numbers of vaccinated individuals climb, those numbers that are likely to get it are going to go down. Those numbers that are likely to be hospitalized are going to drop exponentially.
May I follow up?
Of course.
I again appreciate the speculation aspect.
Right.
But is there a threshold, and maybe Ms. Wooten could address that? Have you guys at least said if this threshold gets to be at a point, and I understand we want to keep people calm,
right.
We don't want to create speculation again.
Sure.
But certainly you've discussed a threshold number, Ms. Wooten, or anyone?
Well, I'll let Dr. Wooten come up and address that, Ed. But I think it's important to realize everything we did surrounding COVID was about protecting the integrity of our healthcare system. And our hospitalization numbers today, even though they have climbed from where we were, are nowhere near where they were in January. And so much of what we did around COVID during the darkest days, during the most difficult days, were to preserve the integrity of our healthcare system. And so, we're going to continue to monitor that. Again, we are seeing an increase in hospitalizations, but the COVID hospitalizations today are still a fraction of what they were in December and January and some of those other peaks, again, because of the vaccine. But there is a strain on our healthcare system. And it's not just a strain because of COVID hospitalizations. You're seeing a lot of hospitalizations for other reasons. And hospitals are also having staffing issues and challenges. Healthcare workers are tired. And so we want to slow the spread. We want to lower those numbers of hospitalizations, and we know the way we do that is get more people vaccinated. And if we do that, then I think we can get through this all right. Yeah.
Question. We've seen a number of breakthrough cases. Why not require everyone, or recommend requiring everyone to get tested, just so you don't have anyone slip through the cracks?
Well, and I'm happy to turn over to the doctors on this one. Testing remains widely available. Testing, again, remains available. We have county sites where it's available. There's healthcare sites where it is available, and anyone who wants a test should feel free to go get a test. I think when you look at the percentage of the cases that are in the vaccinated versus unvaccinated, and the number of people in San Diego County, you realize the risk to those that are fully vaccinated is exceedingly low, exceedingly low. And so I think any individual that desires to get a test, any individual that's concerned, that's why we make it available. And it is readily available. I also think, and Dr. McDonald can add on to this, I think still the very significant number of breakthrough cases in fully vaccinated people are asymptomatic, meaning they have no symptoms. They had to get tested for a work condition or some other type of thing, which is really the only way they knew that they were COVID positive. But let me ask Dr. McDonald if he wants to add on to that.
Thanks. I just wanted to make a quick comment, and I think it's very important to emphasize that anyone who has symptoms that are consistent with COVID, even if they're very mild, should get tested as soon as possible. Our data have shown, actually, unfortunately, very consistently that individuals who become symptomatic with runny nose, cough, fever, body aches will wait 3 days before they even go in and get tested. And so I think it's a very important message that you should know what the symptoms of COVID are, and regardless of whether you have been vaccinated or not, if you have those symptoms, you should get tested promptly. So that's the point that I really do want to make. There are some individuals who do become symptomatic after being fully vaccinated. They generally have much milder illness, but while they're symptomatic, they could be contagious to others. And by being diagnosed, it helps us understand that future transmission in the community and helps us do case contact investigations in the people who may have been exposed. That's why it's important that anyone who is symptomatic be tested promptly.
Just to be clear, so if a county employee is not vaccinated and they don't submit to the regular testing come August 23rd, will they lose their job?
We're working out the disciplinary actions right now through the meet and confer process with our collective bargaining units, but there will be some penalty associated with that.
And in general, have you got any pushback on this? And if you did, who's it from?
Well, I mean, look, you've got a segment of population that is choosing to buy into what somebody posted on Facebook and as opposed to what their doctor told them. You know, there was an in-depth story in Salon about a deworming medicine for horses that is flying off the shelf because people have convinced themselves that that is what will protect them from COVID-19 and not what your doctor and the FDA says will protect you from COVID-19. So you're going to get a segment of the population, Matt, that is has bought into this kind of conspiracy theory notion. But the reality is the statistics don't lie. And your doctor that you depend on and count on, right, that's who you have to trust in this situation. And so we have an obligation to protect our community as a whole. And the way we protect our community as a whole is get as many people as we possibly can to get vaccinated. And so we're going to continue to look for every tool we can possibly use to do that.
And does it also include like county fire employees and sheriff's department employees?
It does. Mm-hmm. It
And
does.
one for the doctors, if they can.
Yeah.
Is this like where we are right now in terms of like, a month ago it was like about 100 hospitalizations, now there's 500. Is it sort of expected with the Delta variant out there and then just the general rising cases? And then in your modeling, is there a sort of peak that we hit, like 700? I mean, because I know we had 2 million San Diego fully vaccinated, so is there a peak that we hit?
Thank you for the question. In terms of a peak or anything, the most important thing is that our cases and our numbers are represented by those people that are not vaccinated. That's really the most important thing to pay attention to. And so vaccinating those individuals is our goal. All of the strategies that we currently have in place are still in place. We are expanding locations for testing and for vaccinations. So that is our focus, to vaccinate those individuals that are not vaccinated. The Delta variant is more contagious, so it is going to cause more cases in our communities, but the more people that are not vaccinated, that get vaccinated, the less cases we'll have showing up in our emergency departments or being admitted to the hospital. And that really is the primary focus, is trying to decrease the impact to our healthcare system. And as these numbers show, again, those that are hospitalized are primarily unvaccinated. And the Delta variant, because it is more contagious, is having a factor in this. So the more people we can get vaccinated, there is no, we have our goal out there to vaccinate 75% of the eligible population, but we want to go beyond that if possible. So, and then we have coming up in the fall, the younger age group will be hopefully eligible for vaccination. So we'll have to start gearing up for that as well, because then that age group, less than 12, 5 to 12 years, or 5 to 11 years of age, becomes eligible, and they will be added to that population. So we'll have to reset our target.
I know that when you guys stood up your last time, the Delta variant was not the dominant strain you guys were expecting. Do you know from sequencing if it is the dominant strain?
It is it's by far the dominant strain. It has surpassed the UK variant, which cumulatively, if you look at cumulatively, we have the largest number of UK variants. But for the Delta variant, it is the predominant variant that's being whole genome sequenced at this time. And that's not just in San Diego, that's across the country.
Dr. Wu, we saw a spike a few weeks after the 4th of July holiday.
Mhm.
In tests, when we were dealing with the Alpha variant, we'd see a spike, then we'd see a plateau, we'd start to see it to drop. Are we expecting the same reaction with the Delta variant?
Well, that has already, the spike is already here. We're in the middle of the surge. The question is, will it get worse? And it will get worse before it gets better. But the way out of that is for people to get vaccinated.
I'm sorry.
Yes.
My question was, the Alpha spike would plateau and start to decline on its own. This is prior to vaccinations. Are we expecting to see that in some fashion as well, or is the Delta variant far more?
It's far more contagious than the original version of the SARS-CoV-2 virus. Again, can't predict what's going to happen in the future, but we know right now it is the predominant. Over 90% of the whole genome, if not even higher, 95%, are the Delta variant.
What is the current turnaround time for getting testing results from county locations? We're hearing some people that are waiting 3 or 4 days who may have breakthrough cases and they want results. And then also, Supervisor Fletcher, you had mentioned that disciplinary actions are being discussed. Can you go over what possible actions might be taken, what's on the table?
Quickly, regarding the turnaround time, it depends on where you get the test. So for the county, it's 1 to 2 days. If tests are being sent out to commercial laboratories, that could be 3 to 5 days. But we are monitoring that. So the important thing is to get tested. If you have symptoms, and back to what Dr. McDonald stated in response to the question about vaccinated people getting tested, vaccinated individuals should be tested if they have symptoms. And obviously, the guidance for unvaccinated individuals to get tested once weekly, we are adhering to that based on CDC and CDPH guidance.
I just wanted to quickly add that, as Dr. Wooten said, we actually do follow this very carefully, which is one of the reasons I do know that people wait 3 days before they get tested from the onset of their symptoms. I can tell you that our latest stats are that about 85% of the tests that are being conducted now are resulted in 24 hours or less, and at about 91, 92% are within 48 hours. So it's actually pretty good turnaround time.
Yeah, and we are ramping up our testing to make sure that it is available in anticipation, one, that more people may desire to get tested. As we see an increase in awareness, an increase in cases, more people desire to get tested. Two, to make sure, as Dr. McDonald said, if someone has any symptoms, we want that testing site to be available, and we want to rapidly turn it around, because all of our contact tracing, case investigation protocols are still in place. So when we get a positive, we still do all the things that we were doing previously. In terms of disciplinary measures, I don't want to comment on those yet. We're in negotiations to determine what those are, but there will be consequences in place. Again, it's not requiring you to get vaccinated. If you don't, then you will be subject to regular testing. and you will wear a mask when you're indoors, because the mask requirement for unvaccinated individuals is still in place. And that is still in place for indoor settings, along with our recommendation that everyone wear them in indoor settings. Cool.
When it comes to the legal authority, I know you haven't done it yet, it's a recommendation to require businesses to have their folks vaccinated
Yeah.
and get tested. Does the county have the legal authority to require businesses to require?
Well, we're doing what we're doing now, and there's a lot of locations, you know, around the state that are doing other types of things, and so we'll monitor, we'll assess, we'll look at those and see.
I know that you've asked this question to staff. Is there a legal justification, and does the county have the ability to require businesses to require vaccinations?
Today we're recommending it. Cool. Any other questions? All right. Thank you all.